Hello guys, welcome back to the channel. It's Unit 10 Part B. Birth asphyxia, which is also known as asphyxia neonatorum, and it is a condition which occurs after the birth. After the birth, if the baby is not able to breathe properly, the baby is struggling to breathe properly, that condition is known as birth asphyxia. And if you see, when the baby is present inside the womb, at that time the baby doesn't breathe, the lungs will not be in the working condition. The baby will be surviving with the support of mother. But after the birth, the baby needs to breathe on its own. But due to some condition, there will be a struggle or the baby is not able to breathe properly. This condition is birth asphyxia. If there is any problem in blood supply or oxygen is not reaching the parts, this is first stage of birth asphyxia. And if there is already an injury because of this birth asphyxia, that is the second stage. Sign and symptoms: the breathing pattern is very irregular. The breathing will be very short and very deep and very quickly, and where you see after sometimes the baby loses its consciousness and there will be a discoloration in the face, lips, extremities and all. This is the sign and symptoms of birth asphyxia. Treatment for the neonatal asphyxia: first, if there is any risk factor that is interfering in the delivery process, we need to take measures for it, and we should avoid the delivery process which is causing injury for the fetus as well as the mother. And after the birth, if there is any kind of complications or any problem to the baby or the mother, we need to provide as soon as possible the care for the mother or the baby. So before itself, we need to prepare the things which are required, that is resuscitation, like oxygen mask, fluids, medications, everything should be pre-prepared. When it comes to main management, after the birth, if the baby has any kind of problem, mainly the breathing disorder, the baby will be placed in the NICU and then the treatment will be further proceeded. And this treatment includes the respiratory therapy, circulatory therapy. And then do remember, if the baby is not able to breathe properly at that time, the toxic substances which is present inside the body will not get excreted, and because of that there will be acid base differences. To maintain that, we need to provide medications, and then if there is no proper oxygen supply to all the parts, then suddenly there might be a injury, because the baby is just born, it's very delicate, and the system, the organs present inside it is also very delicate. When there is no proper oxygen supply, the injury for the organs will be very quick. So we need to find if there is any other complications because of this condition, and then we need to treat it also. And then generally in many babies, seizures occurs because of this condition. So if you see any symptoms related seizures, we need to give treatment as a precautionary measures. These are the management of the neonatal asphyxia. Intrauterine growth restriction, which is also known as fetal growth restriction. By the name itself, you'll get to know there is a problem regarding the fetal growth. It is in the intrauterine, in the condition that's inside the womb. When the baby present inside the womb, there is some kind of factors. It might be either external or internal. These factors actually interfering the growth of the baby, and the baby is not able to grow to the normal level. This is a condition where baby doesn't grow to normal weight during the pregnancy. That is IUGR, intrauterine growth restriction. And if you see, the causes are very simple. First of all, the environment, that's the main thing. If the environment is very unhealthy, then definitely it will affect the growth of the baby. When it comes to internal factors, the placental abnormalities or any kind of amniotic abnormalities, if there is polyamnuria, oligoamnuria, this condition can affect the baby growth. If the mother has any kind of underlying disease and infections, can affect the fetus growth. If you see the causes in detail, the maternal factors are the age of the mother and the small status and high attitude, in the sense the height of the mother. If the mother is very short, then the growth place for the baby is also very small, so the baby is not able to grow properly. Any genetic factors, stress, underlying disease condition, if the baby is undernutrition, if the mother has any bad habits like alcohol and drugs, or the mother is living in the unhealthy environment, can cause IUGR. Placental conditions. Placental conditions, there are lots of placental condition: cord prolapse, placenta abnormalities, placenta tumor, placenta previa, placenta brachia, saturata placenta, and many more. If there is any problem related to the placenta, then that will definitely affect the growth of the baby. Or else, if fetal itself have any kind of disorder due to any kind of genetic condition or hereditary condition, if the fetal has like trisomy 21, trisomy 18, trisomy 13, tumor syndrome, or any kind of congenital disorders, can really affect the growth of the baby. These are the causes. Preventory measures of IUGR. First, primary preventory measures. We will avoid the unhealthy environment. Healthier the environment, healthier the baby. And we will provide a good diet for the mother. And then we will advise the mother to come for routine checkups. On routine checkups, we will get to know whether the baby is growing good or is there any abnormalities present in it. And at that time, we will provide counseling, vaccinations to prevent the multigestation. We will try to prevent the multigestation because it's a main cause for growth restriction. And is there any complications leading because of IUGR, we will try to correct it also. Next, the secondary preventory measures. In first preventory measures, we will try to prevent, we will try to avoid the problem before it comes. But in secondary level, we will try to cure the problem. If there is any kind of risk is detected, we will try to cure here. First, we need to detect what's the problem and then we will treat here. And to see the progress, we will keep on screening the mother, we will keep on taking the measures of the mother. This is secondary preventory measure of IUGR. Let's see the feeding problems. And if you want to know more about the breastfeeding, I have been already explained it in the unit 6 part D video. If you want in detail, you can visit there. Now, the problems during the feeding. First, sore nipple. This is commonly seen in the mother, which is a dry nipple. Baby doesn't suck the dry nipple. Before feeding the baby, you need to moist the area. So, if you want to come over this condition, you need to clean the area regularly after feeding, and you need to change the positions, like for few seconds on the right and for next minute on the left. By doing this condition, you can avoid the dryness of the neck side. Next, infection and the painful lumps. See, even you are following the hygiene protocols, even you are feeding the baby on the regular interval, at some extent the breast infection will occur, which is known as mastitis. If it is just a pain, you can follow the hot compression, the hot water towel. By that you will get the relief. But if it is not just a pain, it's an infection, then you need to visit the doctor. Next, inadequate supply of milk. Okay, it's a very common thing which is seen in nowadays. That is, the milk supply is not enough for the baby. To overcome this, we generally advise the mother to do yoga and some kind of massage around the breast, and eat the diet food which produces lots of milk. And next, inverted nipple. Yeah, here the tip of the nipple is actually inside. Generally, while feeding, the nipple has to come out, but at some conditions, at some complications or infections, it doesn't come out. This is inverted nipple. At this condition, you need to visit the doctor. Apart from these cases, there is one more another feeding problem, that is overfilling of the breast. If the mother is not feeding the baby on correct interval, on correct time, there will be overfilling of the breast. And even sometimes, even the mother is feeding the baby on time, but still the mother's breast might be overfilled with milk. This condition can actually lead to breast engorgement, which is a very worst condition, in which the mother feels pain, tightening of the breast, there will be swelling of the breast. To cure breast engorgement, you need to go to hospital. If you want to get rid of this overfilling of the milk in your breast, you need to express the milk on your own. These are the feeding problems. Questions will be provided at the end of the chapter. Until then, stay tuned. Bye.